Welcome, everybody. My name is Meg Disler. I'm the Executive Director of the St. Joe Community Health Foundation, and we are one of the co-sponsors of the Prenatal and Infant Care Network. Along with us, you're going to meet one of my favorite people to work with is Ms. Paige Wilkins, and she'll be up in a minute to kind of work us through as you see on the agenda. Also serving, we put together kind of a steering committee to help us make these more successful. So I do want to thank Erin Norton is on that with Parkview, and Kayla's on that from Women's Care Center. Laura Dwyer's running around here is on it also from the St. Joe Community Health Foundation. Paige, am I?
Joe.
And
Krista.
Thank you.
Yeah.
Thank you very much. I get introduced you in a minute, and then Krista Peak from Lutheran Health Network. And the purpose of these luncheons are, we believe that as a community, we can do a better job if we are better informed on the resources, the network that's available here in the town, as well as some of the newest information on infant health, on prenatal health, on families that's stressing, families at risk. So we have been working to build programs that you can become better aware of who are the partners in this community. And I can tell you right now, we have on the mailing list, self-identified, 130 professionals who are interested in somewhere in the spectrum from that moment of conception to that baby is age 1, who want to become aware of how to work with people in this room. And so you all are on that list, or if you're not, if you signed in and want to be added, you'll be on the list. And we really appreciate the opportunity to be with you. At the recommendation of the group, we are videotaping each of these components. So if there's people on your team back at your office, or you want to go back and hear something again a little more closely, all of these will be on our website. And the last ones were on mental health, some of the prescription, how do you deal with people who are pregnant, and prescribing medications, what are some of the resources. We had some great local experts talking on that, but we are now videotaping all of this, and we have Remedy Live, Soulmedic is videotaping all of these for us so that we have them available to you at any time. So if you see us a little bit with logistics, bear with us, or if we need to make sure we hear any conversation or comments so we get that piece. I really want to introduce, and first of all, a big thank you to our hostess, Jo Faulkner and her team of Hope Center. So I think we give them up. You can't clap with your hands. This is a great turnout, and so we appreciate you working with us as we've got everybody in here, but we think there's a great value just having a chance to see the facility. But Jo, I'm going to have you give an overview in case people are not familiar with a Hope Center. Sure. And this great work that you're doing in the community here.
We are a pregnancy center, and what we do, all of our services that we do are free. And so when we have clients come in, we don't check their income or anything like that. If they're here for help, we're here to help them. Last year we saw 2,303 distinct clients. We gave 1,941 pregnancy tests. We also tested 1,315 times for STIs. Out of that, we had women who were pregnant and had 1 or 2 STIs. There were 82 of them. And since the cure is pretty easy to ascertain, and we made sure that they were able to get that. We even have a voucher so that they can get the medication, so that they can get that cure before their baby is born and things like that. And so what we're trying to do is end preterm labor because of these 2 diseases. And so we're having quite a bit of success of people coming in and getting tested for STI too. And we did 531 ultrasounds. And we also had 151 of our clients go through our Earn While You Learn, and that's with our bonus room where they get to earn a crib, or they could earn clothing, or they could earn a stroller, or all different kinds of things that are available for them. And so we have 4 locations. One is in Grayville, the other 3 are here in Fort Wayne. This one, of course, on Hobson. Then we have one on Calhoun Street, and we also have one on Illinois Road. And so we're kind of spread out all over. And we also, one of the things that we do too is we really empower them to start making the right decisions. We want them to know that they don't have to settle for this. They don't have to settle for being a multiple partner. Sometimes it's kind of sad when they think that their partner has been monogamous. They have been, and they find out they have an STI. And so then they have some hard conversations that they have to have and some reality checks that they have to have as well. And so those are the services that we provide. If anybody has any questions, and we will let you know too, after we're finished here, if you want to mill around, we have people at different areas so that they can answer any questions that you have. But you can see our ultrasound area, you can see our lab area, you can see all of our counseling rooms and our resource rooms. So help yourself and welcome. So thank you.
Thanks everybody for coming. I love seeing the turnout at these meetings. I thought we could go around and do a quick introduction of who you are, and if you have any brief announcements about your organization that you want to give, now would be the time to do it. I do want to say that we have one update, is we're working on an online referral. A lot of you have asked that we have an online referral instead of paper, so I have listened, and my web developer is working on that, so hopefully we'll have that up and ready to go by our next meeting. Okay. Yeah.
Can we start? Okay. Erin Norton, Parkview.
Jill McAllister, Parkview, Health.
Donna Masterson, the YWCA.
Veronica Munoz, I work at YWCA, but United Way of Allen County, 211. Anybody is out 211 if you ever need any assistance on resources.
I'm Ms. Evan with Fort Wayne Community Schools.
Dana Wyatt, bereavement coordinator at the hospital.
Carolyn Morrison, Scan, annual duck race, selling ducks.
Siobhan Betts, Family Birthing Center Manager at Vandalia, Parkview.
Leslie Miller, birth planner and lactation consultant at Parkview Vandalia Family Birthing Center.
Tyan Achabal, Wick. Stephanie Gehring, Wick.
Courtney Winter, Wick.
And Kale Women's Care Center.
Teresa Barker, Ahoka.
Kristen Willie, I hope so.
Kathy Parks from Healthy Families in Daybreak.
Alice Kupfer from St. Joe Community Health Foundation Board.
Bob Depper from the same organization.
Nancy O'Brien, I'm a nurse practitioner, same organization.
Katie Huffle, I'm with Aging and In-Home Services, working with NICU infants for Anthem, Medicaid, and
Libby Martin with Friends Social Services.
Sharon Poe, St. Joseph County Health Foundation.
D. Scott Smith, Medwise Outreach Consultant. And we are currently working on our annual baby shower. So we will have more information coming soon. It will be in the planning stages, and we'll share that.
Christy Burgess, Member Connections, Rapid Managed Health Services, and Anna from NHS.
Espanilla and then Bushi, and our specialist.
Tanisha Clements, Park Center's Three Wishes Coordinator.
Laura Ogleton.
Natalie Stabler, Echo Catholic Charities.
Melissa Singh, Echo Catholic Charities. Jessica Hanna, Catholic Charities Manager of Community Services.
And I'm Joe Bach.
Stephanie Good, DuPont Hospital Childbirth Education.
Janet Elmer, same thing with company.
Pat Turner, Tobacco Free Allen County.
Marlene Krause, Right Point Early Head Start.
Holly Seabury, McMillan Health.
Rachel Tchaikovsky, Caring About People.
Terry Clark, Christ Child Society.
Ann Beckett, Sing.
Christina Stampley with the House of Grace Center for Pregnant Teens. Actually, my organization helps young pregnant girls and single moms provide for their babies. So I offer all things babies, from diapers to wipes to cribs, all things babies for free. Actually, currently, forgive me if you go back and forth, it's because I'm currently doing a diaper giveaway now, so I have clients that will be meeting me in the parking lot.
I'm Michelle Dion.
Garman. I'm a nurse at Lutheran Hospital and run our mood changes and moms with perinatal mood and anxiety disorder program. And we are celebrating our 10th year this year.
Oh, okay.
Betsy Edmonds, Healthier Moms and Babies.
Tony Giaquinta, Indiana American Academy of Pediatrics, Infant Mortality.
Hey, I'm Sarah Giaquinta. We're both new to the community, and I'm the new program director for the Community Health Improvement Plan for Children. So, Chip, if anybody was involved, I'd love to meet you today.
My sister and myself, we are the needs interpreters for the first step, Indiana First Step, as well as LSN. We see patients from age 0 to 3 for all their health needs. We go out into the community, into the houses, and assess their needs, and we interpret as much as possible.
So I need not to introduce
Yeah,
myself.
right.
And recently, Midwest Authorities Group asked me to interpret for them.
I'm Janice Kuskis. I'm with Mother's Hope, which is a shelter for pregnant women at risk of homelessness that will be opening in the spring. And Parky Randelia and OB, I teach nursing, and I'll be with you in a couple weeks and with
I'm Mary Shankster with Visiting Nurse in the Community Grief Center.
Tammy Ellis, I'm a Child Life Coordinator and Family Support Service Manager at Lutheran Children's Hospital.
I'm Allison Sturm. I work for the Diocese of Portland South Bend, and I'm here for Project Rachel Post-Abortion Healing Ministry and Miriam Blessings.
And I also give a little housekeeping. When you're finished eating, just put your stuff under your chair and we'll clean that up afterwards. And also, there's restrooms right here, and also if you go around the corner past the table where you registered, there's also restrooms there. Thank you.
I'm excited by all the expertise in this room, and I really do believe all of us together, we're gonna be the best for you to take back to the state doing infant mortality. We're not gonna be the worst zip code. That's great. With this Army, what do you think? So, one of the great projects that's actually been launched recently that we want to have an update on is Baby's Love, and Dr. Holly Seabury is going to give us kind of an update on this project.
Oh, thank you. First of all, I have stuff, so if you need more stuff, I have it. I have posters, I have postcards, I have business size cards, and I have your stuff. And yes, we passed out thousands of these. Women's Health Advantage is now putting these in all the prenatal packets. So that's really cool. We just dropped 1,200 off to them. So I pulled our analytics this morning. Since the site launched at the end of February, we've had 596 individual different users, 728 sessions, which means people are coming back, 1,265 page views, which is an average of close to 2 pages per session, which means people are looking through the site. And as we progress, we're starting our text messaging. If you have things that are going on that you want to notify the community of, let me know, and we can use those in the text messages. We kind of want those to be more up-to-date information of what's available out there. And we've gotten a lot of positive feedback on Baby's Love. We're about ready to send out an email next week to everyone who took materials asking if they want more materials so we can pass out more materials to people and get the word out about the site. Does anybody have any questions?
Can you give a quick overview if they're not familiar with Baby's Love, what it is and how to find it?
Okay, Baby's Love is at babieslove.org. It is a site designed for women who think they're pregnant or know they're pregnant. It is a direct-to-user site, so it's not really as much designed to be used by professionals looking for information. It's a direct-to-user site, which is why we do the promotional materials. And on that site, you can find the resources that you need in Fort Wayne. Not every single resource is listed, and I fight an ongoing battle not to have 5 million things listed on the site. this site has a strong health literacy focus, so we make a lot of use of video, and we are listing a few resources, not all the resources. Now, we do link to the St. Joe Community Health Foundation's pregnancy guide where you can find all the resources, which is what we say in the link. If you want all the resources, go here. We are taking a really targeted approach where we're trying not to overwhelm people with information, and we're trying to get them into the system as quickly as we can in their pregnancy. So get them into prenatal care, get them the help they need with finding counseling or the information they need. So we have 5 targeted areas. Do you think you're pregnant, which is where to find a free pregnancy test, where to find a doctor and how to access insurance, how to get stuff for your baby that you need. If you need to talk to somebody, if you're feeling overwhelmed and need to talk, we're linking you to text counseling and then also in-person counseling. And then the last category is apps that can help you have a healthy pregnancy. You can also, if you need help right away, you fill out a form that says, I need help right away. That goes right to Healthier Moms and Babies, and then Paige takes care of that. Her resource person either answers their question if they have a specific question, or enrolls them in whatever they need to be enrolled in and helps them get to where they need to be. So we're really trying to make it, you can find the resources, but if you just feel like I'm overwhelmed and I just need someone to help me right away, you've got that option too. And we're really just trying to get people into the system of care, because we know that the longer women wait to get prenatal care, the worse their outcomes are. And if women are struggling and overwhelmed and don't have the resources that they feel they need, they also may not have a good outcome. So we're really trying to get them the help and resources they need in the prenatal care that we know they need. Any other questions? All right, I got a lot of stuff. So anybody who hasn't gotten Baby's Love information or ran out of it, I will give you stuff.
Well, we can maybe set up some of the extra materials where we had food coming in.
Yeah, I'll go set them
on
up.
your way out, and that'll be easier. And
Yeah.
I know other people had materials, so we don't need the food as we need, since we've been well taken care of. I would like to just jump in very quickly. We love the site. We have, the St. Joe Community Health Foundation publishes the free book on the prenatal resource directory. We've distributed over 8,000 of those. We are in the final stages of editing a new version for 2017. We've worked and built off with Healthier Mom, or with Baby's Love to put a little bit, it's a more compatible piece, but we've tried to put everything in there for you all, care guide support. It's more, we've got the phone book, they've got it easy for a stressed out patient or anyone who's really worried to get a little friendlier approach. So they're meant to be somewhat compatible, and that should be coming out within a month or so. So
oh, and then we'll need the new link so we can relink,
we
because
will
we're
get all
linked to your old one.
So we will be getting that to all of you guys, but again, our goal is to help get everybody linked to resources. If for any reason anything is, new programming comes out, changes the program, keep letting us know, because especially the stuff that's online, we'll keep it as updated for all of you as we can, because we keep getting better and better. So that's great.
And I want to add on that, we have had quite a few self-referrals through that. And we have enrolled a few into our program, but what they're mainly looking for is things. You know, how they can get things for their babies. So we've been really just kind of linking into the different Baby's Closet, Women's Care Center, Hope Center, and a lot of people have been needing cribs for their babies. So.
And that's important.
It is important.
Because if you're pregnant, you're stressed out because you have no place for your baby to sleep, that's adversely affecting your pregnancy. So it's important that we help link women to the resources they need. So, yes.
The biggest need I've seen through there so far is car seats and packing plates.
Yeah. And I have to say, I'm expecting a grandbaby in, I almost said I'm expecting a baby, because in my mind I am. A grandbaby in July, and my daughter-in-law was showing me some blankets, and they were showing me the crib they set up, and my son said, you know those blankets don't go in the crib, right? And I was like, dang, somebody around here is doing a good job with, with safe sleep education, because it's their first baby. And I was shocked that he knew that. And I was like, that's right. Only the baby goes in the crib. And that's what he said, only the baby goes in the crib. And it was like, all right. So somebody in this group did a good job in his prenatal classes or somewhere where he really learned that. So kudos, keeping my grandbaby safe.
Thanks a lot.